SB 375 gives the metropolitan planning organizations the opportunity to redesign communities to encourage active commuting, walking or biking. And we know, again, we know that exercise can decrease the risk of adverse cardiovascular outcomes. It can increase the good cholesterol. Those of you that are my age and get your cholesterol, your lipids checked, know that your doctor wants to increase your high-density lipoprotein cholesterol. That's the good cholesterol, and exercise does that. Exercise can lower blood pressure, it can help weight reduction, it can help diabetes, diabetic control. So exercise is a good thing. And so potential benefit of a smart growth approach encouraged by SB 375 is to increase green space. And we know that green space also has positive health benefits. There are more and more studies that show that actually all overall well-being is improved by contact with green space. I actually think I'm going to make it. So, and many communities, the vulnerable individuals in those communities are the ones that have least access to green space. So, as already has been alluded to by both Carl and Bob, one approach to meeting net zero targets for vehicle miles traveled is urban infill, with higher density residential buildings and shops along transportation corridors. Our next speaker, Rashid Bhatia, with the San Francisco Department of Health, has done a lot of work in this regard, and I'm not going to talk about this in detail, but he was the one who first brought it to my attention a few years ago that this approach can reduce regional traffic-related air pollution. It's a good thing if we have less people, less vehicle miles traveled, less motor vehicle emissions for the region, but it's been alluded to that people that live along such a transportation corridor may be exposed to higher levels of emissions. Now, this idealized picture over here, shows the infill, along a clean electric rail system. But most of you know that this residential infill could be high-density residential infill could be right along a busy roadway with lots of diesel buses and trucks. As has been alluded to by both the previous speakers, and it's really the theme of today's meeting, not all communities are impacted equally by traffic-related air pollution, especially diesel emissions. And I'm not even going to talk about ports or rail yards. I'll just talk about freeways. And these slides are from Southern California, but the same thing would be true here in the Bay Area. This is an important slide for an important study that was conducted by UCLA investigators in 2002. And they looked at levels of particles, and in particular black carbon particles, distance from freeway. So with 100 meters, within 100 meters of the freeway, so 300 feet, you get this huge spike of exposure. And black carbon is a good marker for diesel. And this just shows you there's different kinds of freeways. This is the same kind of data. This is the 405 freeway in Southern California, which doesn't have very many diesel trucks or buses, versus the 710, which is very highly trafficked with diesel vehicles. And then to go from the data graphs to real people, this is a slide along the 710 freeway showing a truck just a few meters away from a house. So people in that house, people with asthma or heart disease in that house would be at risk of having acute health effects. And we've talked about inequities in environmental exposure. There's some science to this, as many of you know, not just advocacy. The science and advocacy go together. Hopefully this science can help inform the advocacy. And Amy Kyle is actually a co-author of this paper done by Amy and colleagues at UC Berkeley. And this is, again, LA. But the map up here shows the non-white population, with darker being more non-whites in census tracts. And this is poverty. And this is cumulative hazard. And the hazard here was diesel emissions and oxides of nitrogen, both good markers of traffic. And you can see pretty much that poor non-white folks get the most exposure. So I think as a public health guy, I want to echo something that Amy started out with, and Carl talked about breaking down the silos. My metaphor is breaking down the walls, but different disciplines have to talk to each other. I was really glad that Bob, the transportation modeler, talked about environmental justice, talked about public health, but I think a lot of transportation modelers don't do that. And certainly a lot of public health people don't talk about transportation modeling. Just, we need to integrate our thinking across disciplines. And so I'll just end by saying the decreased vehicle mile travel targets that the MPOs can have public health co-benefits, including increasing green space and opportunities for exercise. And to realize these co-benefits, we have to work together. Thank you.